So
I'm
this will
here.
be a question and answer session. It's entitled Maintaining Well-Being During a Pandemic. And before anything else, I'd like to introduce to you our speaker, Dr. Marisa De Guzman. Um, she will impart her knowledge and expertise on mental wellness. She's a seasoned psychiatrist specializing in adult psychiatry, psychotherapy, psychosocial rehabilitation, and family support groups. She's a recipient of several awards like the Outstanding Faculty Research Award from the UP College of Medicine, the Outstanding Public Service Award by the Philippine Civil Service Commission, and she has also received the Pag-asa Award in 2006, um, and she also runs the PGH Women's Desk, and she is she's an outstanding alumna of Maryknoll High School, um, and we are very happy to have with us today Dr. Marisa De Guzman. Hi, Marisa.
Hello. Thank you,
Yeah,
Christine, and the
yeah.
organizers for the invitation. I've been with you since early morning, so I've been
Thank you.
watching and
Yeah,
enjoyed every minute of the presentation.
yeah.
Thank you. Kakaiba.
Thank you very much for saying yes. I know you have a conference tonight, but still you're with us. So
Yes.
let me start with some questions that we have gathered, and maybe some of the participants will add some questions in the chat box later on. So first, how do we deal with anxieties and fears arising from the uncertainties during this pandemic?
Yeah. Can I share a slide so that now that
Sure, sure.
if it's all right, you give me a slide share and then
Yeah,
I'd be very happy because there's a, yeah. Okay. So here, it's talking about mental wellness in the new normal. And well, since March 2020, we've all been experiencing a lot of challenges encountered during this pandemic. And I'm not simply talking about, I'm sure this refers to students as well as parents, as well as employees all over because of the new changes that's been happening. And I have my slide share. I'm okay now.
yeah,
Okay.
yeah,
So I'll just put it on full screen so that I can
yeah.
run through the slides because I think it will answer all some of the
The
questions
question.
that you have raised. Yeah.
Okay, sure. That would
And
be nice.
yeah. So I'll just wait for a while. It's loading, but it will come around. Okay. Uh, Amazing, huh? I mean, I'm very impressed with Bosco Gutierrez, Senor Bosco Gutierrez, because he had all the symptoms of going through post-traumatic stress disorder, but apparently he was able to pull through
Yeah,
it, no? And I was able to identify all his positive coping, and I think that will help us through uh, when adversities come around. So I'll just change my slide there. So for students I mean, there's demotivation because, and it's been happening right now. Boredom, lack of gadgets, lack of access to technology. For parents, the financial hardship, difficulty in mobilization during this community quarantine, the worry for the family's health and welfare, and then for employees as well. Delay in the implementation of programs, difficulty in mobilization, low turnout of enrollment, and transition from different learning modalities. Okay, so we need to explore ways in which we can cope, no, that we need to adjust. As he said, no, our intellectual capacity is being able to adjust, to shape, and reorder our lives across multiple dimensions. Okay, so how first, the most important thing in managing anxiety and fear and during this isolation this period of isolation is first you need to identify your external stressors, no? Fear and anxiety of infection, the mental trauma of those infected, no? Maybe even loved ones, the long isolation duration. I've been a COVID-19 patient and I understand what people feel when they're completely isolated. There's decrease in physical activity, unpredictable events, disrupted social relationships, family financial losses. I mean, they have to tighten their budget, managing a different workload in the office or no workload at all, and as well as uncertainty about the future. Okay, so in my next slide will show you that this is a study that we made on children and adolescents' lifestyle behavior, and because of that, in terms of the physical activity that you have here. You can see that before the pandemic, that's when they have school days, they have about 540 minutes of activity, physical activity per week. No, so just imagine 2 to 3. I mean, more than, say, divided by 60. That's more than 7 every day. They have 1 hour a week, 1 hour of physical activity. But during this pandemic, it has been reduced to less than 2 hours per week. What has increased a lot was the total screen time. Before the pandemic, there's total screen time, whether it's video games or watching on Netflix, it's about 610 minutes. But apparently, during the pandemic, it has increased to 2,340 minutes of screen time. So just imagine, no, it can be linked to both negative physical and mental health outcomes. There will be loss of muscular fitness, cardiorespiratory fitness, weight gain, psychosocial problems, maybe poor academic achievement that can have extend to adulthood because of its negative impact. So here, this produces, if it's not abated, it continues to produce chronic stress reactions. So there's decline in job productivity, absenteeism, decreased motivation and job satisfaction. That's why sometimes you have, adolescents switching off, no, if they don't get to listen to their class because they're burnt out. Interpersonal problems, more frequent consultations, and what we call the burnt out syndrome. Okay, so may I go to the next question? How do we cope with
Yes.
stress during
Yes.
this post-COVID? Well, you need to recognize the symptoms of stress, whether it's feeling irritation, anger, and denial. There's feeling uncertain, nervous, or anxious. You lack motivation. You feel tired most of the time or overwhelmed. Sad and depressed. I mean, you have to ask your friends, no, how do you feel right now? And I think having trouble sleeping and having trouble contemplating. Trouble concentrating, but I'm going to end with a positive note. So this is just to summarize what I'd like to leave as a take-home message, no? That will increase our physical and mental health benefits. We're going to go through each one. Uh, uh, we're going to survey each one. Take a proactive approach, stay connected, healthy habits, know the facts about COVID-19, because the fear and anxiety during this pandemic is because we hear a lot of fake news, no, that makes us more anxious and fearful to go out. You need your social support system, and it has been emphasized by no less than Father Orbos and Senor Bosco, and also learn how to relax, no, which requires, it's not to sleep, but it's something that requires less activity on your part. So here, how to maintain wellness during this post COVID-19. Be well informed. Take care of yourself and be supportive to the others. Respect and honor the frontliners, no, who keep our environment safe and free. Sometimes we're so in a hurry, but we have to go through this checklist of getting our temperature, giving us alcohol, having to sign up a contact tracing form. Sometimes we get irritated with that. But no, respect and honor these frontliners because they also have a role to play. Fight stigma and discrimination. What do you do if you're found to be COVID-19? How do you help the others if they're found to be COVID-19? And then the timely referral for works that need counseling and psychosocial support. So you've been talking about building resilience and managing job stress, as has been in your last activity. I noticed, well, communicate with coworkers, supervisors, and employees, and do the best you can to make resources available that you have. In one community, one house was found to be COVID-19, and instead of discriminating and stigmatizing them, and because they felt ashamed, they were all COVID-19 positive, all the neighbors helped, no, and they brought food, they helped with their grocery, they what's this they would run errands for them, even if they have to leave the goods just right at the gate, not at their doorstep, but outside the gate. Okay, then take a proactive approach with yourself. No, as you start your day, try to visualize your day. That's what he. That's I learned a lot of practical lessons from the experience of Senor Bosco. Senor Bosco. No, he made a plan and identify, because that is what we are in control of. Visualize a daily timetable or routine, because that's a constant. That will be the constant that you need to stabilize. No, start your day with reflection and ensure a variety of activities in your things to do list. Okay. Cleanliness at home is very important. Upang mapigilan ang tuluyan nating mapuksa ang pagkalat ng COVID-19, it starts at home. Personal hand hygiene, hand washing, sanitation before entering the house. Because don't be selfish, don't think of yourself, but think of the people you care about. No? And then, of course, know the facts. This one, the government has not stopped emphasizing the need for safety and health protocol guidelines. And the latest news in the Philippines, the numbers are going down. And maybe because of this, it took some time for behavioral changes to take place, but it's possible. Okay? Then be creative about your social support system. Stay connected, no? Because it does have a positive effect on our well-being to keep us centered and grounded, and it reinforces our sense of wholeness that we are not alone. I've heard him say, well, try to stay connected with 3 or 4 friends in a day, say hi, even if just the personal example, but I have a sister who lives down in the Visayas, and we haven't seen her for a year. No, but what she did was she would call my mother every day at 12 noon to pray with her the Angelus. No, and that keeps her connected with. And my mother doesn't miss her as much. Of course, she would like to see her, but she knows it's not possible. So stay connected with each other. Family bonding is very important. You learn to express love and care towards family members, reassure each other that their basic needs will be met, no? And be sensitive to family members who may be worried and fearful, no? You have a family member who does keep on, everywhere she goes, she always has a bottle of alcohol, no? And sometimes you're scared because at some point, over sanitizing can remove the daily oils, the vital oils in your skin, that also has a protective effect on your skin. But the best is clearly hand washing. If you cannot do hand washing because you're outside of your home, then that's when you bring a hand sanitizer. Then organize your home to feel comfortable and relaxed. And what they're advising is have a cross ventilation, because open your windows, because that's one way to fight COVID-19. Avoid conflict and arguments at this point in time. What we have to do is to be very supportive. Bayanihan is very important. Have an emergency plan and know your community resources. Let's say in your house, somebody is known to be positive for COVID-19. So have a plan already. Have an emergency plan. Okay, you're going to be isolated for 14 days. No, you cannot. When you say a quarantine, it's restricted movements and communication. So have a plan, no? That you'll have to bring her food. You'll have to make sure that she has the temperature. Somebody has to check on her 3 times a day to check if her temperature, to ask if she's have difficulty in coughing, and if she feels tired most of the time. All these things have to be done, no? And then you set aside the things that she needs for her self-care, eating, sleeping. That's something that she has always, that her basic needs are attended to. And be willing to make personal adjustments to ensure public safety. It's a shared responsibility with everybody at home. Then the last one, well, healthy habits, healthy living. Learn how to relax. And well, I'd like to teach you relaxation technique, but this is something that you can do at home. You do deep breathing exercises, but progressive relaxation. And there are many techniques in YouTube that teaches you progressive relaxation that will help you to go to sleep, in a very relaxed mode, and it will eventually help you to initiate sleep right away. Next, okay, have a healthy diet. There's what you call COVID-19 weight gain. So we have to all be very careful with that, no? And it's good to eat well. That's what they're saying. It's to help build your immune system, either vitamin C, virgin coconut oil, vitamin D. Well, healthy diet following the food pyramid is the safest because you don't have weight gain, you have reduced cancer risks, you're able to manage if you're diabetic, you have there's heart and stroke prevention on the long term, strong bones and teeth, improved memory, improved gut health. We found out that probiotics help in reducing depression and anxiety. So there are studies already to show that your basic Yakult and also your probiotics and prebiotics help in your gut stabilization, no? Usually when a person is depressed and anxiety, you also feel that you've lost appetite, you're not you don't feel like you want to eat. Somehow it affects your stomach, but then one of the things that they've recommended is probiotics, and it does help now improve the moods, stabilize the moods. Then exercise, no? We've heard it, no less, no? Because it's not simply when a person is diagnosed with depression and anxiety, we just can't depend on medications. No, there are behavioral modifications aside from healthy lifestyle. We encourage exercise, no, to reduce stress and improve ability to cope with stress. We improve their body image, their increased feelings of energy, improve in confidence in their physical ability, and less decreased symptoms that are associated with depression. Okay, then of course, healthy sleep. Okay, establish a relaxing bedtime routine. Okay, and keep a consistent sleep schedule. Now, that's the reason why you have to learn how to control your screen time at night. I mean, when you use your screen time at night, then definitely you will lose sleep over it. Okay. Other coping strategies, well, focus on practical activities that you can do now. And remember, maintain a normal schedule and keep the journal. Now, there are many ways. You just need to be creative. We didn't have time to go out of the house, but we had the roof deck to help us, no, to enjoy the fire rainbow, sunset that we had at our roof deck. But it was good to feel, to breathe clean, air in the city. That helped us a lot. Then, of course, some of you are a binge have a tendency to binge on K-drama, but be careful, watch out. Learn to control that, no? 2 hours every day, maybe it's good because they have and teach family values, okay? And you like it because it makes you laugh, it makes you intrigue, it makes you enjoy things. Second to the last is the respect for frontliners, to fight stigma and discrimination if you're found to be COVID-19, and timely referral for workers needing counseling and psychosocial support for those with mental health problems. So you have there your psychiatrist, your doctors, because they're the ones who diagnose a person who may have mental health problems. I've had a video to show you. I'm not sure if you've seen this, but this is one of the videos that they show. I'm not sure if I put on I'll stop share and just stop share and put on the audio so that you can hear it from your end. Okay. Uh-huh. Because there's a share optimized screen when sharing, and now I can share. Okay. This is short. It's only one.
My name is Nicole. My life changed after I was diagnosed with depression and generalized anxiety disorder in 2006. To understand what it means to live with this, I need to tell you about the spoon theory. Let's say you're given 10 spoons a day, and everything you do takes up a spoon. Getting out of bed and showering, that's 1 spoon. Meet a friend for lunch, 2 spoons. Writing an article is 5 spoons. Now, what do I do with the spoons I'm left with? Spend time with loved ones or sleep? With my depression, I don't always have 10 spoons a day. On bad days, it might be less. When it feels like I've spent all my energy, I turn to one person, my husband. I find courage in his love and affirmation. Today, my recovery story is a positive one because of his unwavering support, medication, and therapy. In truth, there are very few mental health affirmation stories in Singapore. But knowing that I can help someone out there by sharing my experience with others through writing, it's what keeps me going. At the end of the day, 10 spoons or 2, I can still make a difference.
Okay. So I'll go to the next, and this one is a social experiment that they did on mental health, and it's very moving.
You can be born perfectly rich, have a very good lifestyle, have parents who care very well for you. I don't think mental health issues discriminate against anyone of any race, gender, or social background.
Hi, nice to meet you. Please have a seat.
My name is Nicole. I'll be your moderator for this discussion.
I'm Nicholas. Today, I'm going to ask you a few questions about mental health in Singapore. What do you know about mental illness?
I just know there's depression.
How do you say that? Bipolar disorder.
The wire short circuit, you know.
This guy's crazy, all these kind of words.
Has nothing to do with me.
Would you hire somebody with mental health condition?
I'll probably, make them work in a, admin side.
Sweeper, cleaner, or some simple job for them.
Either they hurt themselves or they're going to hurt somebody else. Then if you're mental illness, you apply for a job. But who in the right sense would really want to take you?
Would you date somebody who has a mental health condition?
Some of them will get quite manipulative. They'd say like, if you break up with me, I'll cut myself or I'll kill myself.
And then sometimes they tend to post unreasonable things, such as like a small thing that happened, and then they will make a big fuss out of it.
I cannot handle. I don't know how to handle.
How would you react to, a friend or family member who's diagnosed with mental illness?
The bridging needs to be the family and not a stranger.
不是专业医生，我们可能处理不了。
If possible, I will just stay away as far as possible.
这个笑也最好是不要靠近他。
I didn't introduce myself fully. I suffer from clinical depression.
I was clinically diagnosed with depression. I'm living in recovery.
And I overcame it. I wrote a letter that I would like you to read out to me aloud.
"12 years is a long time to live with a mental health condition.
In the 12 years that I have been diagnosed with depression,
This is what I've learned.
I've learned that the greatest battles we fight are the ones with ourselves.
I've learned that most conversation about employment end the moment I review my diagnosis.
I've learned that shame is something society teaches you.
I've learned how to say sorry for showing symptoms of my condition.
I've learned that friends can disappear, and I will never hear from them again.
I've learned that family doesn't always know how to support you, no matter how much you need them.
I've learned that hope is a little voice that whispers maybe.
I've learned that recovery is a process.
I've learned that one small crack doesn't mean I'm broken.
I've learned that I have an illness, but this illness is not my identity.
So sorry that you have to go through this.
I'm so
Do you have any questions you want to ask me?
Okay, I go forward. So just to I have three take-home messages for everyone, no, and maybe it also summarizes what we have to do, no, and how to cope with anxiety and stress during this COVID-19 quarantine period. Take a proactive approach, stay connected, and focus on your health. No? And this is just one experience that I've had when I was quarantined for 1 month, no, 2 weeks before and 2 weeks after. So I established a routine in the hospital that I was staying. I visualized my day. I cleaned my own room. You know, I was cleaning my own room, had all the materials brought in. I started my day with a prayer, attending online mass. I made a schedule. I made a list of things to do and varied my activities by attending webinar and doing exercise. Stayed healthy. So aside from the hospital food, I cooked my own, I prepared my own food, nothing cooking, just eggs and vegetables to take care of oneself and be supportive to the others. And I think the last one is, well, I just wanted to inform you that we're doing a national survey for mental health. I hope you can support us. We're going to the different regions. For those who want to apply as lay interviewers, we have a Facebook page, Lingap Pamilyang PH, Lingap sa bawat pamilyang Pilipino. So we have job offers for those who are who want to become lay interviewers. Maraming salamat po. Sorry, I hope I didn't take uh, the whole time, but I hope it answered most of your questions about mental health. Thank you.
Thank you, Marisa. You really answered our
Everything.
questions, so I won't go through them.
Yeah.
Thank you so much. Well, the Institute for Integrality is one with you, the mental health
Yeah.
professionals, in helping people to achieve wholeness in spite of all possible challenges like depression and other forms of brokenness. And now we have Positivity Incorporated to focus on
Yes.
positive
Congratulations.
psychology. Thank
Yeah, I'd
you.
like to congratulate the group. You've gone a long way, but we need that. We need that kind of thing for young
Thank
people.
you. Yes. Marisa,
Okay.
just one
Oh,
question. Just one
yes.
question, because there are many educators in the group, no, amongst the participants. And there's this one question that I would like to share. How could parents and educators help children who are overwhelmed with the current school's setup? You know, just like the other day, I have a niece who has been calling me to solve her Sudoku problem. And the Sudoku given to her is so different from the Sudoku that I know. And so she doesn't know where to go to. So how?
Okay.
We
So
call it
the
module,
first
etc.
thing, yeah. The first thing that children need is support and your presence the presence of parents in the house, the presence of anyone already assures them that they're not alone in solving this problem. So maybe what they need to do is, because the child is overwhelmed, so what the parents has to do is sit down with the child and try to break down the task into small tasks. Okay. What is achievable, like making smart goals, measurable, that's time bound, attainable, realistic. So make use of smart, you start with that. Let's make smart goals. Okay. So break down the task and then give the time enough time duration, give breaks for them, and ask the child, okay, let's go. Because with children, it's very sequential. You go from one level to another. So that's the way you break down the task. They go from one level to another until they're able to, and they really need help. especially in trying even to maneuver their tablet. They need help in that. So you can have the older siblings take on the little ones, and while the parents can take on the older siblings who have problems. So it's really everybody gets involved in this. And then please, for parents, no, make sure that you have some physical activity with the children, that they go learn how to ride a bike, do some running outside the house, play Filipino games, whether it's patintero or tumbang preso, whatever, or just play ball, throwing the ball or the baseball or whatever, volleyball, just or playing badminton. Encourage physical activity on, whatever homework that they have to finish for that day. Then plan out your weekends. No, try to do a variety of activities. Instead of having dinner on the table, maybe you can make pack lunch, no, and everybody eats outside the house, no, just to make something different or add something new,
Dine
no,
out.
for the children. Because yes, make it fun time. Everything is fun time. Okay. So you can simply ask the children, how are you doing right now? What are you feeling? Can I help? Okay. So these things break down the small tasks and make it smart for them.
Okay. Thank you
Okay.
very much,
I,
Marisa.
yeah, just one, just one thing that I wanted to warn parents and teachers. Please take care. Watch out for cyberbullying. Okay, and you have to talk to your children about it. No, when in because of course the class has a Viber group or a chat group or an iMessenger. Try to look into their chat groups and Viber groups, and if you see somebody bullying, report it right away and talk about it with your children, that this is something wrong, not to shame anyone. Bullying physically, cyberbullying has more trauma to the child than aside from bullying physically. Why? Because everybody gets to know about it. So uh, take note for parents, no, and educators. Teach your children and stand out to fight cyberbullying. Okay, I've done my
Okay,
job.
thank you. I know you have another Congress, International Congress,
Yeah,
that you
thank
are an
you.
organizer. Thank you so much. We'll pray
Yeah.
for that.
Bye,
Thanks,
everyone, and take care.
Marisa.
Stay healthy and
Bye-bye.
happy. Bye.
Yes. Okay, thank you
Congratulations
so
in
much.
advance, Christine.
Yes.